Hi everyone, good day. My name is Kay Samar Latomba, your student nurse from Davao Doctors College, and today I am going to perform the demonstration of the newborn care. So newborn care which is defined as the management of neonate and of course the subsequent period of stabilization. So first is wash your hands prior from preparing the materials needed such as the cotton balls, the sterile gloves, and the umbilical clamp, the bonnet, the forceps, the syringe, the measuring tape, the vitamin K, the HEPA B, the BCG, and the operating sponge, and the ophthalmic ointment, and the kidney basin. So afterwards, identify the infant by properly looking at his or her name, wrist tag to identify the infant identity. So enhances infant's comfort by keeping the environment warm to prevent the heat loss that the pain result to the hyperthermia. And of course, perform hand washing before doing the procedure. So after that, weight the newborn correctly so that we will have our baseline data. So now, let's proceed to the record dressing. So this procedure helps us to prevent infection around the body cord stump. So put the sterile gloves, then properly restrains the upper and lower extremities of the newborn. Using OS with ROH, disinfect the cords 3 times from the base upwards to hold the baby in the place into the gain proper access of the cord and also to protect the cord from contamination. So now, put the sterile OS at the base of the cord and clamp the cord with umbilical clip 1 to 2 inch from the base of the cord. So now clamp and cut the cord using the plastic clamp about 2 cm from the base after pulsating stock within 1 to 3 minutes after birth, so prevent anemia and intravascular bleeding. So now, OS lays the base of the cord. So now, cut the cord about 0 to 0.5 centimeter above the cord clips and express the remaining blood of the cord with the OS placed of the base of the cord So now, place the OS at the base of the cord, stamp at the pour 70% ROH over the cord. So this is to ensure that the remaining blood is stuck within the cord of the baby and to provide the most optimum condition for healing by removing remaining debris and contaminants from in and around base of the cord. So now, let's proceed with the vitamin K. So this is needed for the blood clotting to prevent serious diseases called hemorrhagic disease of the newborn. So now, withdraw the exact amount of vitamin K from the ampule and inject into the middle third lateral aspect of the infant thigh. So now, let's inject the hepatitis B vaccines about 0.5 ml of the intramuscular. So assuming that this is the hepatitis B vaccine. So now, let's inject the BCG vaccine about 0.5 ml into the intradermal right deltoid. So, assuming that this is the BCG vaccine. So the lateral aspect of the infant site is preferred site of the intramuscular injection. So because it is the most or the bulkiest parts of the time, so this is provide the protection against the hepatitis B virus or the HBV right away and the vaccine given to the babies to protect them from serious forms of tuberculosis and miliary tuberculosis. So now, let's proceed to the initial bath. So hold the newborn in the football grip manner, folding the both ears to maintain the comfortable position of the baby and prevent the water from the entering through the ears. Then carefully washes the newborn head with the use of the baby soap or mild shampoo and wipes dry thereafter. So the baby soap and the mild shampoo are preferred for the babies because they are unlikely to cause irritation to baby skin. So now put the baby's diaper, shirt, mittens, and booties so diaper are given to the absorb and hold the baby's waist. While the mittens and booties protect the baby's finger and toenails from the trauma to prevent the baby from scratching his or her face. Then, wrap the newborn security in a clean blanket to maintain the wrap and of course, place the newborn to the crib and drop the lights on and touches the crib tag. So because the crib contains infant to prevent falls while drop lights maintain the war of the environment. So assuming this is the name tag, now let's shades the newborn eye from the light and open up, then open one of the eye at a time by exerting a gently pressure on the upper and the lower lids to protect the infants from infection or the ophthalmic neonatorium. So now I'm applying the ophthalmic ointment from the inner to the outer canthus. So assuming that this is the ophthalmic ointment, so making sure that the tip of the medicine tube will not touch the eye of the newborn. To follow the principles of starting from the area further from you and take the newborn vital signs are good indicator of the newborn adoption and survival, such as the temperature, heart rate, respiratory rate, and saturation. Now, of course, lastly, do the aftercare to maintain the cleanliness and record the procedure done and the other pertinent data. So this will serve as to prove that the procedure was done and the communication among the professionals of the health system through the exchange and information that concern hand washing to prevent the spread of the microorganism.